Else?
Michael!
Thank you, Marco. Just wait for this to line up. I have slightly lost my voice today because I was in the bar quite late last night and I was arguing with Helena about polynucleotides. So this is specifically about for you. So the test that was done, we took one of the leading polynucleotide products in the market, and we tried to compare quantitatively directly to Sunekos. So we didn't use anything like global aesthetic improvement score or wrinkle severity score. We tried to actually measure the differences in cell output in the skin comparing to polynucleotides. And the methodology is very simple. So we used Sunekos Performa, we used a particular polynucleotide product, and then we use a control simply to compare everything to as well. And then we measured the specific protein output directly from those cells. And we looked at all the different collagen types that yesterday I gave you the list for. We looked at elastin and we looked at fibronectin as well. So it's a very simple study. And I'm going to talk you through the results. So collagen type 1, I'm sure every product makes it. It's one of the most common types that there is. But let's look at what the result actually is. So when we used Sunekos, we had an almost 50% increase in that collagen type 1. Whereas in polynucleotides, you can get negative 10%, plus or minus the standard deviation as well. Now, I can explain why things can be negative, but in order to not go on for 3 hours and to put you all to sleep, I'll save that until afterwards. If you want to ask me, personally, I'm more than happy to explain it to you, that's not a problem. And Tiziana, I think this is a couple of weeks before this is published, is it?
It will be published in 1 month.
Around 1 month this will be published.
It's a study that it has been done at the University of Pharmacology of Milan by the head professor there, Professor Enzo Nisoni and his team. And they compared Sunekos Performa to, let's say, probably the most popular product with polynucleotides in the market. Okay, so I'm repeating. My voice is loud anyway, but the University of Pharmacology of Milan took Sunekos Performa and compared it in vitro. Okay, Sunekos Performa and probably the most common product with polynucleotide. I'm not mentioning the name if you guys want who is, but I mean. And what we aim to demonstrate with this is the proper activity of the product. Because when you are injecting, then you are adding the mechanical stimulation. That anyway, whatever you are injecting is doing something, even if you are injecting saline solution. So we decided to run it in vitro, and we used the same methodology that they declared in their trial. Okay? And then, so we also took an independent evaluator, so the university, and these are the results. So comparing the pure activity of the ingredients, so without the injection, and then there is a comparison protein by protein, because many claims are there, but here you see, when you talk about collagen 1, what is the direct action of the product? Collagen type 4, 5, 7, elastin, because there are many claims. But here you see that protein by protein, what is the direct action? So without the mechanical action of the injection. Sorry.
Yes. Once again. So collagen type 4, this is, to remind you, collagen type 4 is roughly speaking around halfway through the epidermal junction. So we have collagen to link directly to the keratinocyte in the epidermis. That is 17, and a particular integrin, and laminin, I think 332. And then we have collagen 7 going directly into the dermis as well, where we find things like 16 as well. 4 is the bridge between the top and the bottom half. So we showed that Sunekos increases by roughly 233%, and compared to the most popular polynucleotide, we saw, this is after 96 hours by the way, these measurements, we saw there was no change. Even taking into account the standard deviation, obviously clearly quite a large improvement there. So collagen type 5, this is a type of collagen known as a facet fibril-associated collagen with interrupted triple helix. This is useful for other types of collagen. So even collagen type, let's say 9, for example, is used to make sure 1 is correct. So we showed that with Sunekos, we showed again almost a 50% increase, whereas with the most popular polynucleotide, there was a 31%. However, it was statistically non-significant for this, as you can see by the standard deviation that was present. Collagen type 7, again, to remind you, this is the final link into the dermis. Collagen type 7 is what physically holds the type 1 and type 3 in position. So if you increase type 1 and type 3 more and more and more and more, you don't necessarily have increased function because you need the type 7 to hold the type 1 and 3 like I'm holding this remote here. So we showed that Sunekos produced a roughly 38% increase, and with the most popular polynucleotides on the market, even taking into account the standard deviation, there was a massive, massive difference, and this was indistinguishable from the control, so 0%. Type 17, so yes, this connects into a hemidesmosome at the base of the keratinocyte, so this is a transmembrane collagen. And we showed that with Sunekos we have a roughly 40% increase in this particular type. And again, even taking into account standard deviation, it was a vastly huge difference compared to the most popular polynucleotide on the market, and that was indistinguishable from control, so we can say roughly 0%. And then elastin, you all know what elastin is. Almost 250%, so 242 to be exact. And we showed that there was actually a slight decrease in polynucleotides, even taking into account statistical error rates and standard deviation present as well. Now again, there is a reason for this, which I will happily explain to you one-on-one if you want to know afterwards. And fibronectin, just to recap for those who don't know, it is very important for things like stem cell differentiation. It is useful for positioning other proteins in the right position in the extracellular matrix. So you can have multiple proteins made. Things like hyaluronic acid are used to position cells. Things like fibronectin are used to position other proteins. So it's part of the scaffold. And we showed that with Sunekos we got roughly a 105% increase. And with polynucleotides we showed indistinguishable from control one more time. So we can say that we have a higher production of collagen in terms of overall amount of collagen, the volume of collagen. We can say that there are more collagen types. I've put only 5 tested here because there are other types which, in my opinion, are also being produced, but I have to twist Tiziano's arm to do those tests as well. It took a year for me to get him to do this test, so probably in another year's time we'll have some other proteins for you. We also produce more elastin, more fibronectin. And therefore, because we are producing things that are naturally found in times of growth, so say when a child grows into an adult, as opposed to just when a scar is made, we can say there is, well, in my opinion at least, there is a superior potential to remodel everything within the ECM, as opposed to just select proteins like type 1 and type 3.
I hope everything is going on well. I hope you like the way we are managing these sections. As you know, science has always been our core. We know probably we have to do marketing, but science and doing marketing through science is our nature. So I hope you enjoy. Now we will see another presentation coming from Dr. Andrea Bocca, where we explain also how to leverage on the trend of young people who want to have anyway aesthetic treatments. You know that the attention to skincare is more and more present in young people. We did some trials where we will be demonstrating that we can have a relevant role in prevention of the aging. This means that we will find the space also in young people. It doesn't mean that we are competing on other treatment like limbs and so on, because that is a sort of improvement of the shape and so on. But here we are adding a new treatment in order to prevent the aging. And we have significant data to demonstrate that we can play this role. I'm calling now Dr. Andrea Bocca for this part.
And yes, there is this question, when to start, when is the right moment? For many things, when is the right moment to get married, to get divorced, I don't know, there's always a right moment. When is the right moment to start Sunekos? And if we look at what we are doing, in the end, we are improving life quality, we are reading their minds, we're helping them feel better about themselves. Okay, but still, how young can you be to start Sunekos treatment? Because now if we look at the young generation, I think if I'm asking my daughter, she would like some treatment as well. Because it is a trend. If you look into their minds, this is what everybody is looking for nowadays. They all want to look good, but now they want to ensure they're looking good from before they do that. So there's a big difference. I mean, if I look in the age of my parents, or if I look last week, I had a lady, she came in, she is 65, and she genuinely looked at me and said, "Doctor, I decided it's time for me to come and start doing something about my face." So with the same honesty, I answered to her, "Oh, you're considering a facelift?" She wasn't happy with my answer. So it is true, that generation thought only about corrective medicine being the only option for them prevention was about cardiovascular diseases. It was never about aesthetics. Now the new generation, the Gen Z, and if we look at even us, even from millennials on, they are more and more digging into what can you do to ensure that you will age well. But despite the thought and all this big fuss out there about skin quality, that it is so needed and so true, prevention is still not fully proved by so many companies. Although data, and there's a lot of literature on the topic, says that patients are wanting and patients are needing it because prevention is a reality, not just in cardiovascular diseases and in general medicine, but it is also a reality in the aging process of our face. Although the young generation, they're shifting the paradigm from going from correction into prevention. These are nice words that we are telling you, but until just very recently, we didn't have a real proof that that was possible. Because although we wanted, although the patients wanted, although the industry was communicating on it, there was no significant data for most of the injectable companies on the real proof that prevention is real. Because if I think I'm doing Sunekos for prevention, I'm lying to myself. It's not prevention anymore, it's cure. Because my fibroblasts, they are still metabolically active, but they're not producing by their own collagen elastin, and you know this. So this is not prevention anymore, this is correction. But I don't look that bad. Is it correction already? Correction is not about looking good or bad. Again, being ugly never killed anybody. Prevention is about having everything still perfect and doing something to ensure that it will stay perfect for you. And this is the real prevention. And this real prevention, you see it forecasted out there. I mean, preventive sculpture? Are you kidding? I mean, let's be serious. Do you use collagen stimulators that we know they create fibrosis? And yeah, in a normal patient, yeah, okay, fine, there's place for every product. But can it prevent aging? There's no way that we can call fibrosis a mechanism that's part of preventing aging, definitely. Because when you say I want to prevent aging means I want to keep my fibroblasts in a good shape, still working on my behalf when it is going to start aging. But bringing data on this, scientific data on this, is very complicated. Because if I take one of you and we start doing together a clinical trial, it means that we have to keep on going with the clinical trial for at least 10 years, no? For you to age, I take a 20-year-old patient and I need to wait for at least 10 years to see is it working or not. So Sunekos saw the need, and what they like to do, they dig into it. And they put together in the university of Milan in the pharmacology department, a very nice in vitro study. And then there were doctors asking me, why not in vivo? Because they didn't have 10 years time to wait to see the results. They wanted to see real results in real time. So the clinical trial, of course, will show us more data, but in vitro data is what we can have fast to understand if prevention is a reality. And the clinical trial is gonna come, but the in vitro trial is looking like this. They took young skin that you can see in the white column, and they put it through accelerated aging using doxorubicin. And that means that that white skin, that white column that you're seeing there, has aged very fast. And it was looking the gray column line. So the gray column shows you how the skin will age if I don't do anything about it. And then they pre-treated by putting Sunekos Performa to work in the young skin, and they aged it again. And you have the blue column. So white, young skin. Gray, aged skin. Blue, aged skin which was pre-treated with Performa. And look at the markers. Senescence markers. These are proteins related to the life cycle. So look, 40% and 100% less aging if the skin, when it was young, was pre-treated with Performa. This is really strong data that we didn't have in our hands before. Take a picture of them and really think into it. Look, inflammatory markers, interleukin 6, interleukin 8, inflammation related. 30% less. So we are aging 30% slower from the inflammation point of view as well, not only from the chronoaging point of view, because we are preparing the fibroblasts for the aging process, and oxidative stress as well, because that's everywhere. Look, even the white column is not flat, it's not zero. We have oxidative stress even in young skin. So this is the real proof now in our hands, that if a 27-year-old person comes into my office asking, what can I do to make sure I will age better, now I know scientifically, and I can hold the truth and say, now I know, it's Sunekos Performa, very simple protocol, only 2 sessions. And this is backed up by science. Because we were even saying we're doing Botox preventively, we were doing this for prevention. Prevention for aging means I'm going to my fibroblast and talking to the fibroblast, keep behaving in the youthful way you are. I'm not going and stressing him by inflammation. And this is, and really we have to admire, you want to say something? I think this is very good because he's the mind behind this, so please.
The mind is not me. No, Paolo is the mind. I would like to add something on this presentation. If you go back to the slide where you are showing the interleukins, okay, perfect. So, doxorubicin, the model with doxorubicin is an approved international model to replicate aging. It means that by applying doxorubicin through this methodology, you are simulating the aging. So, the comparison, it's like to say, when you are young, and here you simulate the aging, and then here is, you are young, you add Sunekos Performa, and you simulate the aging. This is the kind of thinking that you have in mind. So, considering the same kind of aging, if you are pre-treating, then you see that you are getting there in a better way. And all the parameters has been calculated with this methodology. The reason why we also choose interleukins because it's one of the most relevant parameters to evaluate the inflammation. So, sorry if I've interrupted, but I wanted to stress more and more why the model, what is doing the model, and why some parameters. And on the last one, so these parameters is really important to, how can we say, evaluate the oxidative stress and the cellular turnover that is lowering. As we see, when we are pre-treating with Performa, This is lowering is less. Because of course it's aging. We will be aging. There is no other solution, unfortunately. But we can age better.
Thank you, Tiziano. So see, now you hear the same explanation twice, so now it's very clear for everybody. Because it was very hard to put together a way to prove how it will age. And doxorubicin is the standard for that. And now you see how we really can age better. And just like Tiziano was saying, we hear a lot of talks now about biohacking and stopping aging and really reversing aging. And we are far from the ability to reverse aging. But slowing it down into our skin is already a huge step forward. And knowing that we can start at early ages and do something about it is very important. Because with the oxidative stress, it's everywhere. We cannot interfere with outside parameters. We can only do something about our skin and our patient's skin. So now the proof is in your hands that this is how each single one of your young patients can age better, because they will come to you when they are young, but you want them to stay your patients for many years. And you want them to age better, so that when you will be placing fillers into their faces, it will be more supported by skin quality. Yet when you will be doing lasers on their faces, they will heal faster. So this is not for us to tell you that only Sunekos works. This is for us to tell you that Sunekos is like water. This is what your skin needs to age in the best way possible, and then give the ability to also do whatever else you consider is needed, knowing that you have the ingredient that is optimal for every single one of your patients now, not only for cure, but also for preventive reasons, real prevention in the skin. Because we've been knowing for such a long time that Sunekos is amazing for cure and for helping us, people over 35, but now we know and we have the proof that prevention is real and is out there. And this is something unique, because if you start digging into the literature and into competitive products and looking, do I find a replication of this? Is there such data from the competitors coming with real, strong, serious proof? Look out there, I invite you, because you will be surprised that something that's spoken so much out there, because everybody is talking about rejuvenation and prevention. It was just a talk and was never really endorsed by science. And now we have the real endorsement on the topic. So when is the right time to start? Right now. The moment your patient is stepping in for every single one, not only for cure, but also for prevention. As young as they come, that's the young, and this is the right moment to start. You have the right tool in your hands, and you know how to be very safe on the face. And now we're going back to the body. If you have any questions for the prejuvenation, because with Tiziano many times we were talking that it's not so easy to understand the in vitro model that was done. This is why he felt like stepping up and explaining it again to you. So if you have any questions on what and how they did the trial to prove real preventive effects, this is the right time for you to ask. So Tiziano, it looks like in between me and you, it's clear for everybody, because for prejuvenation, nobody has questions. They all are now confident that they know how to prevent the aging in young patients as well. And now moving on into something that we were speaking about yesterday, it is the body and the body market. And we were talking yesterday with Gerardo that he was saying, oh no, it's good to talk to the doctors about this, because really they're not doing so much marketing on the body. Because everybody, indeed, like you said it last time, your main focus is the face. And it is also the major request from the patients. So it is who brought your patients to you. And you all are here today because you have a lot of patients, which are already coming to you for this. What about expanding? What about just making one step further and expanding the indications for the very same patients? You don't even need to go out and search for other patients. Because the ones that you already have, they already have cellulite, and we already spoke about this yesterday. But why bother to dig into a new market when I'm already doing so good with the facial market? Well, because there's very little competition, so you can expand even more. There's an increased addressability. I showed you yesterday market data on how much patients mind having cellulite and how much money they're willing to put into it. That you have safety and efficacy with a real efficient product, and you can address a volume market, because 9 out of 10 of the females, they have it. And they say it's a fair world, right? Well, let me tell you, 2 to 4% of male patients have cellulite. Let's not talk about how fair it is, let's take the good part out of it. 90% of females have it, so that is a huge market out there for us. And it is very important for life quality. Now, that's because I know you've been eating a lot, let's do an exercise. Close your eyes for 1 second, all of you. Think you're on this beautiful beach. Dubai is too hot, so think you're in the Maldives. And you're standing up from your chair, going towards the beach. Everybody's staring at your gorgeous body. Now cellulite appears. How much would you pay to make it go away? This is how much money the patients are willing to put on the table. Because when you don't feel the self-confidence, money is not an issue. In the end, why are we treating vitiligo? Is it killing our patients? No. Why are we treating acne? For the same reason. It is all about life quality. Why are we treating alopecia? I mean, having no hair never killed anybody, right? So there we go. It is just like that our patients are willing to take a step and go in this direction. Of course, we can believe that you can just think about it and it will occur. We know not. But now we have the right science in our hands to understand it deeper. Because it is out there, and we were asking yesterday, where do you stand? And it is so frustrating that I know that 9 out of 10 ladies walking in, they have it. Why is nobody asking about it? Well, why? Because they already thought they had the cure. And the cure definitely for them was creams, massages, LPG, fellowship, and everything out there. They thought they knew it, and they tried it so many times, and yet results were not stable, failed to appear. This is why the satisfaction rate was so low. 10% of them being very satisfied, because this is what they were trying. And now we know that it is not sustainable, because either it's too superficial or it's pro-inflammatory. This is why they were not asking about it anymore. Although their perception on injectable treatments, they know it's much more efficient than topicals and than devices. And look what, it's increasing. For the next 10 years, even their willingness to put more money into it, into injectables, is increasing. But what they do not know is that these injectables out there for cellulite, there is a real big proof. But it's not going to be easy for you, because you need to open a market. But I mean, you can be visioneers and start on time. It's like with wakeboarding. You need to start on time to be able to get on the big wave. If the big wave is already out there, you've missed it. When everybody's treating it, when everybody's using it, well, guess what? You again have a full room of competition. So now you know scientifically that you have the market out there because there's 9 out of 10 female patients, and then you have the right tool to do it. But if everybody has it, a lot of voices say, let's just accept it. I mean, if 9 out of 10 patients have it, female patients have it, let's normalize it. Because I mean, it's just cellulite. Well, being ugly is just being ugly, and yet everybody's coming for beautification. But why is it so important for them? For life quality impact. Because if we look into the data, look here, 25% of patients who have cellulite are severely impacted by it. So they take it as a major problem, as common as it is. And if you look into the numbers, I mean, 80% self-esteem issues, 70% social avoidance, 50%, the ones with severe forms, report associated depression to cellulite. So it's a very strong impact on the life quality. And let's go deeper. 78% of all patients, they want to put the money into the treatment because they feel very bad about it. 70% of female patients think that men notice it. And you do notice it, right? They're not wrong about it. And then 40% of them already received at least one unpleasant comment on the topic. Only 4% of patients, they're totally fine with it. So think how much life quality is coming from cellulite. I mean, everybody's talking about, I don't want to frown anymore, but how would you like to feel better in your body? So this is how deep cellulite goes, and now we know where it's coming from, because again, it was associated for a long time to fat, and we know it's not fat. It's associated to everything that we've been discussing today, extracellular matrix remodeling. And in addition to that, inflammation, in addition to that, vascular deficit. So this is why going by the same pathway we've been going with cutting, subcision, being aggressive, bamboo aggressive massages and all those crazy things, of course they can't give sustainable results because cellulite is about too much inflammation already. And if we dig deep into the science, and I think we drove you crazy with science today, all letters and numbers, but just for you to have a better understanding on cellulite, those of you who don't already have dissected all over, just like on the face we have the SMAS, on the body we have fascia superficialis. Under it, the fatty lobules for patients with and without cellulite, they're oval and they lay quite flat, so everything looks good. Above it, right under the skin, they become polygonal for patients with and without cellulite, so that's how they look. Now, those polygonal fatty lobules, they herniate through the dermis in patients who have cellulite. In the other ones, they don't. Of course, the bigger the lobule is, the more it will herniate. But in patients who do not have cellulite, even if they're overweight, they will not have it because herniation is not occurring. And for patients who have it, even if they have smaller lobules, it still herniates. So why is it herniating? It's herniating because the dermis, the skin, the ECM, is not able to contain it. And now we know that there's something that's called MMP14, which is a main local metalloproteinase, a main local collagenase, that is cleaving, it is too elevated, so it's cleaving on the collagen architecture, it is destroying it. And then on the other hand, we're having fibrin 3 glycoprotein strictly and closely linked to elastin, which is decreased. So overall, we're missing elastin and we have deficit of collagen correct architecture. So it's pretty much like an aged skin. This is why the fatty lobules are herniating increase, and this is why this is the right point to approach, in addition to the fact that we need to remember that cellulite is a chronic parapathology with a multifactorial drawing. So, of course, if you could convince your patient to go to the gym, eat healthy, avoid stress, stop smoking, and so on, results would improve even further. But the bad influences are the ones that I have been showing you that overlap in the 4 stages. But some important things have to be pointed out, like the fact that in stage 4 we already have sclerosis. So we need to start on time. Because sclerosis, by definition, it is already irreversible. So by the time we have it, those plaques are not reversible. But in stage 4 you have other things as well. So you can still target inflammation, you can still target fibrosis, so there's still a lot of things you can target. But the plaque, the sclerotic area itself, will not get improvement. So the sooner we start, the better it is, and this is what we want to do. We want to remodel the extracellular matrix with the exact mechanisms you heard today, through the low-weight hyaluronic acid in combination with the patented hyaluronic acid formula. And then we want to go into reducing inflammation, key point, and also neutralizing acidosis in order to further improve the reducement of the inflammation. We want to be anti-fibrotic, right, because you have it there. We want to bring more blood flow, so angiogenesis. And these are the key points, the therapeutical key points, how we can act there. And we have the right tool that we saw also yesterday. And I'm sure that most of you have already seen the package, that it comes with a big vial of 10 ml with already prepared combination of low-weight hyaluronic acid and amino acids, the patented formula that we find in all the products. But in addition to this, you will find that 5 ml vial of carbonate and bicarbonate that will ensure slow release targeting the acidic pH. And this with injectable therapeutic indication, not only aesthetic indication. Why? Because it targets the exact pathophysiological mechanisms that we have inside cellulite and that today we know due to science. Now, why we have hyaluronic acid inside, I'm sure you all know by now the answer. We're going to the CD44, so we're rebuilding the extracellular matrix by rebuilding homeostasis, not driven by inflammation, and this is very important. And the same molecules I was mentioning to you yesterday, they will trigger also endothelial receptors, so angiogenesis will be there for you, another key achievement in patients with cellulite. And then the hyaluronic acid patented formula, what will it do for you? It will bring you a strong anti-inflammatory effect, and this is something that you really need in cellulite. And then there will be those small perfect bricks to build on the protein synthesis, and they will also improve a lot the collagen type 7 production, which will be giving you that anti-fibrotic effect that you need in cellulite. And then bicarbonate and carbonate to top it up with neutralizing the acidic pH. So as you see, it's a very complete overview that we are having. This is why it is the right tool in your hands, but now we need the right patient. Because this is another point. We have the right device, but we need to know how to select the patient. Initial stage is excellent. Do we also have skin laxity? We associate it to Sunekos body, and Marco will give you more insights on it in a second. But remember, Sunekos cell is not about the fat. Of course, many patients who have cellulite, they also have localized fat, and there's also patients without cellulite who have localized fat, but Sunekos is not about the fat. Somebody yesterday was asking, do we do it before or after we inject lipolytic agents? So if the fat is the main concern of the patient, because some patients have both, and listen to them, figure out which is their main concern. But just remember that when you inject any lipolytic agent that you shall choose, maybe phosphatidylcholine, deoxycholic acid, maybe enzyme lipase, maybe liposuction, all of them will work by inflammation, so you will have overcoming from their fibrosis, because it's going to be driven by inflammation. So then Sunekos cell will be your product of choice after that to work on the fibrosis that has been generated. And if you do liposuction, you're destroying a lot of your lymph and blood vessels that are supplying and covering the area, and then angiogenesis becomes even more important for you. So for those patients, also you need Sunekos cell, but after you deal with the fatty deposits. But for everybody else, if cellulite is the main concern, then Sunekos cell is your best answer. Only remember that in advanced stages, when you have already stage 4, you will have sclerotic plaques that will not go away. And talking about diagnosis, it is so important for you to make diagnosis with lipedema, differential diagnosis. But come on, it's clear, I will not treat the number 3 patient from up there. I know that in late stages, the differential diagnosis is so easy from the door, but remember that in initial stages, they look quite alike. So you really need to assess them thoroughly to be sure it is cellulite and it is not lipedema that the patient has. Does that mean that Sunekos in lipedema has no benefit? Sunekos in lipedema has benefits, because lipedema is also about inflammation, and it is also about fibrosis, and it is also about vascular dysfunction. But lipedema's main issue will be the fat. So just remember that in lipedema you primarily need to target the fat and then everything else. While Sunekos will be able to cover everything Sunekos cell that has to do with cellulite. This is why differential diagnosis is so important. And it has indication in all the stages. But remember that the sooner you start, the better it is, because you don't want to end up in phase 4, where patients mostly see the sclerotic plaques, and those ones you can no longer fix for them. Contraindications, they come from all injectables, the same because they come from regulatory. But remember that not only you have a device which is super efficient, but it is extremely safe. It's not exacerbating inflammation. Worst things you can have, bruising ecchymosis, who cares about them? It's real sustainability in results, and it can cover 3 areas, each area as big as my palm. We always target the trochanteric area, and we pick 2 more. Ask the patient what they want. Some people mind more the frontal region because they wear skirts, some people mind more it in the back because it's more visible. I don't know. Figure out which are the main 3 areas of concern, because with 1 box you can cover 3 areas. Of course, 2 boxes will allow you to cover 6 areas on each side. But 3 areas on the left, 3 areas on the right with 1 single box, and each single one of those areas will get a treatment that you need to repeat. In initial stages, minimum 3 sessions. Advanced stages, you go to 4 sessions. How you display the product, exactly what Marco was explaining, try to be as much as possible perpendicular to the lumbar lines, because you also want to reposition tissue. You want to tighten the tissue to help it contain better those fatty lobules that tend to herniate out there. And I will just play for you the video that you saw yesterday, just to get the chance to tell you that it must be a protocol. When you pack it and you sell it in your clinics or to your doctors, because many of you are distributors in the room, teach your doctors back home that it has to be a protocol, and therefore they should sell it as a protocol. Because if my patient pays separately for each session, my patient is looking for each session separate results. And with rebuilding tissue, it is about time and repeating and giving time to the fibroblast to do what you expect it to do. Because it's not by stress, but by homeostasis that you are working, and that takes time. So this is why when the patient pays for 4 sessions as a fact, they will mentally understand that results are being assessed after the 4 sessions, and you will not have patients who just want to pay for 1 session. Because do I have patients which want to pay only for 1? Of course I do. Do I accept that? No, because I know they will talk bad about the product. No, but I just want to pay for 1 doctor to see if it's working for me. No, 1 session is not working for you. I'm not going into this because I know that they will be disappointed. because it's not, nothing is magic in this world except for Photoshop, and this is so important for us to pass it on because of what I was showing you yesterday. And again, yesterday I got a complaint with one of my pictures saying it wasn't perfectly standardized, so I would like just to show you at the end the same picture again to make sure we're not playing with the lights, because this is so important. We want to give reality to the patients, and I would like to dig with you deeper again into the clinical studies. And I know they're annoying. Who likes clinical studies in the room? Who likes reading clinical studies? Oh my God, Marco, yeah, I know. Oh, okay. So you see how few? Because generally it's just numbers and data. But who knows that clinical studies are fundamental? We all know it, right? Okay. So we know that they're fundamental because they don't talk about, oh, look at my one clinical case, how beautiful it is. Is that reproducible? Is that going to work in Mexico? Is that going to work in France and all over the globe? Because one of my cases responded very well. This is why we need clinical trials. And this is why I was telling you yesterday that Sunekos, it keeps conducting post-marketing clinical studies, because we like that are able to see what happens with different population age groups, with people who smoke, people who don't, people who train, who don't, and so on. And just very briefly digging again into another clinical study with, again, the same protocol, very simple, because we always, through the clinical studies, we want the protocol to be the one you are using in your clinics. So we don't want it to be in any way different. Again, only 3 sessions, though sometimes in more severe cases we do 4 sessions and even more. Follow up throughout the 3 sessions, and then again at 3 months and 6 months, because this is when we suggest that the protocol should be repeated, and it's very important to see that we maintain results throughout the 6 months. It's just not immediate things that you see that look like they are magic. What is the S case? The satisfaction of the patient reporting statistical significant improvement every single time. What is the clinician saying? Exactly the same. So again, we have a very good cohesion between what patients and clinicians see, and that is statistical significant improvement for each single one of them. And what also is very important, the tolerability and what they feel about it. Is it worth doing the treatment? Absolutely statistically significant. And then the scale to show us how much are we going down, how is the severity scale improving, again statistical significance. So this is what's telling me that this has been conducted on 40 patients. So this is not my clinical experience on 2 patients. This is something that will be relevant for each single one of your patients with statistical. You all know that number that we were taught in university. Be less than 0.001, which means that it is relevant and it touches significant statistical significance in every single one of these aspects that we are showing to you, including tolerability, including satisfaction of the patients. Because in the end, I can be very happy with what I'm seeing, but if my patient is not seeing the same, the patients have to put down the money, and they are the ones which are advocating for your treatments once they go home and see the results and assess your results. And then the OBC scale that we were talking about yesterday, this is what's digging deep into the mind of the patients. What they feel about their self-esteem. How would they feel into their... Do they feel that the Sunekos cell is making them feel better about their bodies? And this is the most important part. Better about their bodies, less body shape out there, and more consciousness that they can control is this one. And that they can control what they do about their body, and this is so important. They know that there is a way to control what cellulite does to them, and of course it will never disappear, but it will look better each single time, and this is of such strong importance to us. Because again, what does it mean to be healthy? It doesn't mean just to be sick. It means to have a complete well-being, and that includes feeling good about yourself, your face, but also your body, because we are all one. And this is just for us to really think how important it is to open the body market to your patients, to dive deeper, although it's not easy. Because the results are there, and this is the picture that I changed to give you the exact same angle, and again, same angle, same improvement for the patients. Is cellulite something that disappeared? No, you still see a little bit of it, but it improves at least 1 point for every single patient. And it improves in a safe, sustainable way with results lasting till you need to start again. So overgoing 6 months when you will be repeating the product. And if you look at it, it's not only cellulite improving, it's also the skin being more tight, being like lifted like a fat. And that is due to the collagen type 4, type 7, and fibronectin, which are encouraged proteins for you. And they are visible from the first session because of skin texture, but again, you need the full protocol to maintain them. So we need to understand cellulite better because now science is giving us the answers, and we need to know how to promote it. Because just promoting before and after with the vanishing of it will bring a lot of patients to my clinic, but I will not be able to provide those results because those do not occur. So now you know what results you can promise to them, and now you know what results you will really have with them to make the right choice. And of course, lifestyle changes would help you even further increase their understanding and their expectations, but also repeating. For them to understand that even to the gym, I can go heavily to the gym for 1 year and then I don't go anymore. I can brush my teeth for 40 years, then I don't brush them anymore. So, of course, everything that's important for us are things and gestures that we need to repeat and we need to educate them. But the most important thing is that when they understand, they become chronic patients with lifelong results that you can really maintain, because it's not only about aesthetics, it's not about the beauty of the skin, it's about really the health in this chronic parapathology that you have out there. Because we need to understand cellulite in order to give the right answers. And now I hope I convinced you that Sunekos is the right answer by science, by pictures, by clinical data, because it is something that can really change your practice, but you need to put effort into it, because it's not a market by demand, it is a market by offer. So everybody who's coming into you, all your female patients who come in for Botox, make sure that in the lobby, on your TV, on your social media, they see that you are providing an option for their cellulite, because 9 out of 10 will be grateful for it. This is my Instagram. If you have any questions, or if you have them right now, I'm here for you. Thank you.